Hi there, welcome. My name is Austin Campbell. Today is September 10th, and this is my week 2 presentation, 5-minute short presentation. I will be talking about the different definitions that or the different terms that we have to define and give examples of. You should be able to see my window right now. And just before we start, I wanted to let you know that a lot of my examples, I want to be a dental student, and a lot of my examples are related to dentistry because I feel that's what I know best and can most easily relate to. But the first term right here at the top, we have disease definition, which is pretty much just straightforward. It's just the definition of a disease. How is the disease defined? So the example I wanted to use was periodontitis, which is a gum disease involving inflammation of the tissue surrounding the teeth, and that's just what it's defined as. That's the disease definition. And then we have disease classification, which is each disease has its own specific, maybe a set of signs, symptoms, or other aspects that kind of classify or characterize the disease, the pathology, and the etiology. So the example, again, with periodontitis is just that periodontitis is classified as a gum disease, and it involves swelling and a plaque buildup of bacteria that leads to irritation, the swelling, and possibly infection, and in some cases, pain, which is another symptom. Then we go on to etiology, which is really just the cause of the disease, and the cause could be, as outlined in week 1, there was bacterial or biological causes, which could be bacteria, physical causes, chemical causes, or even nutrient excess or absence that we're missing that could all, kind of cause the disease. So for the dental example here that I have is that with periodontitis, bacterial caries and bacterial presence build up and cause this plaque to and this infection to give rise to periodontitis. The next term, pathogenesis. Let me see if I can just start highlighting these. Pathogenesis is kind of just the beginnings of the disease or the development of the disease as it goes. So for periodontitis, as plaque builds up, swelling too builds up, and it gives rise to infection, and that can increase pain, redness, and eventually, if untreated, it could lead to loss of teeth altogether. So it's very important to not go down that road. Symptoms are kind of just, they're one of the types of clinical manifestations, and they are more qualitative than quantitative. You can't really measure symptoms. They're more subjective. You don't see them. It would be if the patient came into a dental office and said, I'm having tooth pain, and that would be a symptom. And then signs. So signs are more objective. You can go and actually measure signs. So whereas they came in having pain, maybe you could take an x-ray and notice there's bone loss in the tooth socket. Or maybe you would be able to physically measure with using periocharting, a perio probe, the pocket depth between the teeth. And if it's a large pocket, you know that that's a sign of periodontitis there. Syndromes, the next one, are just kind of groupings of signs and symptoms that kind of go together and are almost a characteristic of a specific disease state. And then the example I wanted to use for dentistry would be like cleft palate or lip, which occurs when the palate or the lip, the palate itself bone does not fuse properly during development, or if the maxilla does not fuse properly during development. And that can go with a number of different symptoms, including like difficulty swallowing, difficulty breathing, maybe nasally voice, and ear infections is another one, since they're all closely related. Diagnosis is just the condition that the patient actually has, the condition the patient is suffering. So, for example, the diagnosis for periodontitis, you might want to not, you could be periodontitis, but specifically sometimes we would say um, localized acute periodontitis of the upper right canine, and it's a specific diagnosis, and that's what the patient is suffering at the moment. Complications are things that can occur, could as a result of the disease, like down the line. It's kind of an extension of the disease, or maybe an extension or an adverse, reaction or interaction with treatment or medication. So, an example of that would be maybe an infection of one tooth spreading towards the nerve underneath the teeth, and or maybe a undesirable or unforeseen reaction with a medication that you're giving the patient. Maybe there's an allergy. Those would all be complications. Prognosis is kind of just the assumption of how the disease is going to progress, or the outcome of the disease down the line. So when we're talking about periodontitis, maybe the prognosis there is that with proper care and cleanings done professionally and removal of plaque and then upkeep, the periodontitis should subside within maybe, you say, 2 months, 3 months, if it's properly taken care of. The last one that we're going with is diagnostic media. And this one is kind of just what I found to be a method or maybe an instrument used to come to a conclusion about a diagnosis for a particular disease. And one we use all the time in dental offices would be just like an x-ray machine. It's some kind of media or some kind of instrument that you're using. You take the x-ray of the patient's mouth, and then you find bone loss, perhaps, and that can lead you towards your diagnosis of periodontitis. So that's all of them. This was actually kind of fun. I've enjoyed this. I look forward to doing the rest of the week 2 things now. All right, signing off. Take care.